Now let's talk about the various risk factors that can give rise to AML, the etiology and the pathophysiology section. Now, this is these are the important risk factors. You can't say that it is an etiological cause. There is no causal association. But in certain people, we have seen that the people who have a certain type of genetic disorders like the Klinefelter syndrome or the Turner syndrome and the Down syndrome, specifically the Down syndrome, they have an increased propensity to develop the acute myeloid leukemia going onwards. Secondly, in certain types of radiation exposure, specifically the ionizing radiation exposure, the X-rays, the gamma rays, and also in the nuclear exposure. Historically, after the Second World War, which happened in 1945, going down the lane, the people who were exposed to the nuclear power radiations, going down the lane when they were traced 20 years down the lane, a lot of them developed the hematological malignancies, including AML. So radiation exposure, the ionizing radiation generally also can give rise to acute AML. It is also one of the risk factors. Similarly, certain types of chemical exposures like the benzene exposure. Benzene is the classic chemical which is used in various types of factories like leather or petroleum industry. It can give rise to acute myeloid leukemia. Certain types of occupational exposure like plastic and leather exposure chemicals over a long period of time can give rise to the AML. It can be a risk factor for the development of AML. All of these are generally risk factors. It does not mean that anyone who is exposed to the benzene, everyone who is exposed to the benzene will develop AML. It just increases their chances, increases their odds of getting that disorder as compared to a general population. And finally, certain types of drugs, specifically the anti-neoplastic drugs, chemotherapeutic drugs which we use to treat the other cancers, unfortunately, since they affect all the cells of the body, and if they are used for a long period of time, they also have a propensity to make the person susceptible to various hematological malignancies, including AML. So these were the general etiological factors or the risk factors. Now let's briefly talk about the pathophysiology. We all know the basics. We start off with the stem cell, the hematopoietic stem cell. It can go into a myeloid lineage or a lymphoid lineage. Here we are only showing you the myeloid lineage. So from a hematopoietic stem cell, we form a myeloid stem cell. That gives rise to a myeloblast or a myeloid blast, and that eventually gives rise to the various types of granulocytes, the monocytes, the neutrophils, and the basophils. What happens in AML is acute myeloblastic leukemia or acute myelocytic leukemia, that the development is arrested at this stage, either at the myeloblast level or the myeloid stem cell level. So these are the cells that, rather than dividing and going on to forming the monocytes and the granulocytes, they start dividing. This myeloid blast cell will start dividing, will not differentiate, but it will divide and give rise to a clonal population of all myeloblast cells. And since they are earlier stages of development, they are not very functional as compared to the fully differentiated monocytes and granulocytes. These are not useful for the body. They do not perform their functions of defense, which the white blood cells generally do. So this is the stage at which the development is arrested, and then on the further clonal differentiation, monoclonal differentiation of this myeloid blast cell will give rise to a whole army of neoplastic cells, which will basically harm the body and give rise to the malignancy or the acute myeloid or the myeloblastic leukemia. Since it develops on the blast cells, that's why we can use the term acute myeloblastic leukemia or acute myeloid leukemia interchangeably. The better term to use, in my opinion, is acute myeloblastic leukemia, because it gives us a good idea of the disorder. Since myeloblasts are the germ cells which are found in abundance in these people.